How did patient autonomy evolve from medical paternalism? Imagine a time when doctors made all the decisions for their patients, believing they knew what was best without asking for opinions. That was the era of medical paternalism. In those days, healthcare providers acted like guardians, making choices based on what they thought would benefit the patient most. Patients had little say in their treatment plans and often weren't even told all the details about their health or options. This approach was rooted in the idea of beneficence, meaning doing good for the patient, but it often ignored the patient's right to decide for themselves. As society changed, so did attitudes toward healthcare. Starting in the 19th century, people began to value individual rights more. They wanted to be involved in decisions about their own bodies and health. This shift was driven by broader social movements advocating for personal freedom and self-determination. Patients started asking questions and demanding more control over their treatment choices. This growing demand for involvement led to the development of the concept of patient autonomy. It means that patients have the right to make informed decisions about their health care, as long as they are capable of understanding the information. To do this, doctors must give patients all the necessary facts about their condition, treatment risks, benefits, and alternatives. This process is called informed consent, and it became a legal requirement in many countries. Initially, informed consent focused on doctors sharing information. But over time, it became clear that respecting autonomy also means making sure patients truly understand what they are agreeing to. This led to shared decision-making, where doctors and patients work together. They discuss options, consider the patient's values and preferences, and reach a decision that fits the individual's life and goals. Shared decision-making recognizes that patients are not just passive recipients of care. Their social background, personal experiences, and relationships influence their choices. This approach is especially important in complex or long-term treatments, where ongoing dialogue helps tailor care to the patient's needs. Today, patient autonomy is a core principle in medical ethics. It has shifted the relationship from one of authority to partnership. Patients now have the right to accept or refuse treatments and to choose among options based on their own values. This change is reflected in practices like advance directives, where patients specify their wishes in case they cannot speak for themselves later. Assessing patient competency is also vital. It ensures that patients understand their options and can make decisions. When someone cannot do this, healthcare providers involve surrogate decision-makers or support systems. This evolution from paternalism to autonomy has been driven by societal values of individual rights and self-determination. It has transformed healthcare into a more respectful, patient-centered process, where the person's voice truly matters in their own care.